So greetings to all of you in Zoom land. My name is Mike Klassen, and I'm the Vice President of Public Affairs at the BC Care Providers Association. I hope you have your sandwiches and reheated leftovers at the ready for today's terrific Lunch and Learn panel on point-of-care rapid testing. Before we start, I'd like to acknowledge that we are hosting this meeting on the traditional lands of the Coast Salish peoples, including the Squamish, Musqueam, and Tsleil-Waututh nations, and extend our appreciation for the opportunity to hold this dialogue here today. This session is co-hosted by BC Care Providers Association and SafeCare BC. It is an opportunity for all of us to learn about how care home operators in BC can access and use rapid point of care tests as a screening measure, adding an additional layer of protection against outbreaks of COVID-19. As many of you will know, increased use of rapid testing is something that BCCPA and SafeCare BC have been advocating for over the past several months. And in early March, the province announced a new rapid testing strategy, which would include long-term care, assisted, and independent living settings. We are delighted to have colleagues here from the healthcare sector with us today to talk about the work that they're doing to roll out these tests and how operators can access them. As many of you will also know, several rapid testing technologies were approved in the fall by Health Canada. The Government of Canada purchased over 20 million test kits and distributed them to all provinces and territories on a per capita basis. Approximately 1.5 million test kits have been available for use, paid for by the federal government since last November here in British Columbia. As of today, only a small fraction of the tests have been put into use. In response to growing calls for their use by BCCPA, SafeCare BC, and others, a 2-month pilot was begun at the beginning of December to explore how the tests could be used in long-term care and their effectiveness. I'd like to acknowledge Dr. Mark Romney at Providence Health for his leadership behind the scenes, working with Vancouver Coastal Health on this pilot. I'd also like to thank Northern Health and the Fraser Health Authority for their engagement with BC Care Providers and SafeCare BC, and being patient with our persistent calls regarding the use of the tests. Today, we have up to 7 long-term care and assisted living sites in Fraser Health conducting rapid tests. And I'm told that if other sites wish to implement their own rapid testing program in Fraser Health, that emailing POCT, that's point of care testing, POCT@fraserhealth.ca will immediately get that process started. What the pilot proved is that rapid testing works and can save lives. Rapid testing is not so resource intensive that it cannot be implemented in the care home. The tests are most effective during the critical infectious period of the COVID disease, and that rapid antigen tests will catch asymptomatic carriers of the virus. Our colleagues across the country have been contacting us at BC Care Providers in recent days about the greater spread happening of the virus thanks to the South African and Brazilian variants. We need every tool in our toolkits to stop COVID in its tracks, even with vaccinations happening. Now, we'll begin with a presentation from the Provincial Health Services Authority, who have been an important partner in establishing today's information session. After that, we'll have a brief conversation with the rest of our panelists before moving to an open question and answer session. My goal is to have our discussion wrapped up by 1 o'clock sharp. Please submit your questions for the Q&A using the chat function. Jenny Cannon from SafeCare BC will be moderating these for us. And if you have any technical issues, please also direct your questions to Jenny, who might be able to help. So without any further delay, I'd like to introduce our panelists, and I'll have them all turn on their cameras if they haven't done so already. Zahida Esmail is the Director of Pandemic Response Clinical Services for the Provincial Health Services Authority. In this role, she provides leadership for various aspects of the COVID-19 pandemic response. Zahida has a Master of Health Administration degree and an undergraduate degree in pharmacy from the University of British Columbia. Dr. Victor Leung is trained in internal medicine, infectious diseases, and medical microbiology. He is currently the medical director for infection prevention and control and the physician lead for the antimicrobial stewardship program at Providence Healthcare. Victor distinguished himself by launching the rapid testing pilot back in December by posting a video on the TikTok social media platform and posting his progress with the pilot on his Twitter account, which you must subscribe to. Dr. Nancy Maddock is a medical microbiologist from St. Paul's Hospital, Providence Healthcare. She has worked with several long-term care sites in Vancouver Coastal Health since December 2020 to implement the rapid testing point-of-care screening for COVID-19. Debra Hauptman is the CEO of Langley Care Society, operator of Langley Lodge, a long-term care provider that has had its own unique and challenging journey over the past year. The organization is currently participating in the Fraser Health pilot for rapid antigen testing and has been selected to participate in a self-testing pilot. Barbara serves on the BC Care Providers Board. She is a registered psychiatric nurse and holds a master's in business administration. Debra is a strong advocate for rapid testing in long-term care. And finally, Sharon Roberts is a clinical nurse specialist for long-term care and assisted living at Vancouver Coastal Health. She participated in the development of standardized procedures, education materials for use during the rollout in long-term care homes. So I'd love to thank all of this fantastic panel for joining us all here today. And last I heard, about 150 of you who've registered for today's presentation. So now I'd like to turn over the floor to Zahida for her presentation, which is still, if it was a print product, the ink would still be drying. It literally was just completed. So Zahida, please take over and give us your presentation. Thank you.
Thank you so much, Mike, for that warm welcome. I'm just going to pull up my slide deck here. Give me a moment. Okay, I'm just going to do a quick check-in. Can you guys see my slides? Yeah, okay. Just a second here. Apologies. Here we go. Okay, I trust you guys can see those. Again, thank you so much for Mike for that warm welcome, and good afternoon, everyone. I really appreciate the opportunity for me to share information today about the provincial COVID-19 screening program. I'm going to spend the next little bit just giving a really brief overview on the background, talking about the nuts and bolts of the provincial point of care screening program, what's required from an implementation perspective, a little bit about how to perform the test, some information about training, and then the resources that we have for you. As Mike said, on March 4th, the province released the point of care testing strategy, and the provincial rapid point of care screening program follows the guidance established by the provincial health officer and the Ministry of Health. So we're going to spend the next few minutes to outline at a high level the various different components of the provincial program. Point of care screening tests are available in select settings where there is an increased risk of transmission and/or outbreaks, including long-term care and the continuing care sector. These test kits are intended for use in individuals without symptoms of COVID-19 and are meant for screening purposes only and not for diagnostic reasons. The rapid point of care screening program will provide advice and guidance and assistance in accessing the provincial supply of these test kits. And organizations that are interested in accessing these kits need to comply with guidelines and requirements and standard operating procedures, which we have posted online at the BCCPA website, and need to enter into an agreement with PHSA, the Provincial Health Services Authority. Any site that chooses to use point of care screening needs to ensure that they meet provincial implementation standards and reporting requirements. They also need to ensure that all positive results are reported to public health and the health authorities for follow-up, and ensure that point of care testing is a complement to and does not replace or allow for the relaxing of existing public health measures in the setting. On March 16th, our provincial health officer, Dr. Henry, issued a letter to clarify whether accreditation is required. As of now, an organization that intends to conduct diagnostic testing or is intending to charge the individuals being tested require accreditation under the diagnostic accreditation program that is administered by the College of Physicians and Surgeons where applicable. Organizations that are conducting screening only for asymptomatic individuals through the provincial program don't require diagnostic accreditation, program accreditation, and may follow the PHSA quality assurance processes. And details of these requirements are outlined in Dr. Henry's letter of March 16th, which is available on the screening website. To ensure public safety, reporting is a really critical step. So I'm going to spend a moment or two just to walk through what these requirements are. So when an individual tests positive for COVID-19 through a point of care screening test, this is considered a presumed positive result. All positive screening test results require a confirmatory PCR test, which should take place as soon as possible after the point of care screening test is performed. All positive point of care screening test results need to be reported to public health within 3 hours. And this needs to happen through two means. One, through electronic means to the BCCDC, and secondly, via fax to the public health unit at the regional health authority where the screening took place. The individual should receive a confirmatory PCR COVID-19 test performed in a laboratory or through a COVID-19 collection center afterwards, as soon as possible. There's a few ways that the reporting needs to take place. The reporting needs to ensure that the requirements of the Public Health Act are met, as well as additional requirements, for example, those that may be set by the provincial health officer. As I mentioned earlier, it is imperative that the results are reported in a timely fashion within 3 hours of the test results. Only positives are required to be reported to the BCCDC. And this may be done through an electronic format, which is referred to as an E-form. And on the far right of the screen here, there's a handful of some screenshots just for information purposes to give folks a bit of a sense of what it looks and feels like. And in addition, as I mentioned earlier, positive results also need to be faxed to the Regional Health Authority Public Health Communicable Disease Unit where the screening took place. In addition, there is also weekly reporting to the Ministry of Health. Organizations need to provide information on test kit usage. And I apologize for the small font here, but this is a screenshot of the Excel spreadsheet that organizations that participate in this program will have access to, and the reports need to be sent on a weekly basis directly to the Ministry of Health. Okay, having covered some high-level requirements in the program at a glance, I'm now going to dig into some of the implementation standards that operators will need to be thinking about as they begin to think about what is required on site. At the time the strategy was written, one of the pieces that we were mindful about was the requirement for a regulated healthcare professional. And since then, there's been some progress made on this front, and this is no longer a requirement. And I'll speak to that in more detail as I get further along in my presentation. So the details of the next few slides can be found online at the website for the program in the guidelines, requirements, and standard operating procedures for the provincial program. With respect to management of the site that is conducting point of care screening, it's important to ensure that there will be a lead on site that has responsibility for overseeing data collection, testing, reporting, ensuring quality assurance activities are met, ordering supplies, ensuring infection control procedures are in place, that there is someone responsible for staff training and supervision. In addition, there needs to be somebody responsible for making sure that there's an implementation plan, including any kind of site-specific policies that may be required with respect to implementation. Also to ensure that the plans comply with infection control and prevention practices, and ensure that there's clear pathways established for ensuring that the confirmatory testing and appropriate follow-up care takes place. In addition, also to ensure that the testing kits and supplies are stocked and accessible to staff, and ensure that there is a workflow for end-to-end data collection and reporting, and as well to ensure that there is compliance with all applicable laws from a federal and provincial perspective, and ensure that that the obligation of employers are adhered to as it relates to adhering to any orders issued by the provincial health officer, or any specific guidance that is in place for the industry, and to ensure that those that are participating are aware that this is voluntary and that informed consent is required and established according to the Healthcare Consent and Care Facility Admission Act. With respect to training and competency, operators will need to ensure that staff have completed the required training. Training is required for anyone that is collecting or observing self-collected nasal swabs, and for individuals that perform these tests to ensure that important quality and reporting standards are met. Staff procedures also need to be in place to ensure that individuals maintain their competencies after training and on an ongoing basis. With respect to the space on site, one needs to ensure that there is private space available for point of care testing to take place so that discussions can take place and in a way that ensures client confidentiality. Need to ensure that there is a very secure location where sensitive materials, such as paper copies of test results, can be stored to maintain privacy confidentiality, and ensure that personal protective supplies and waste containers are available on site in the testing space. From a quality assurance and reporting perspective, there needs to be a space where the test kits can be stored securely in accordance with the manufacturer guidelines, a plan in place for staff to report on issues or concerns that may arise during the testing, ensure that the testing is performed in accordance with all of the quality and health and safety procedures and protocols that have been established for the program, which includes maintaining quality control logs and training logs to ensure compliance with quality assurance standards, as well as ensuring compliance with the reporting requirements that I described a short while ago. So that was a fair bit of content, and I'm now going to go into a little bit about using the rapid antigen point of care screening test, the Abbott Panbio nasal test. And I'm going to show you a video of the test, and I hope that this works out. I'm going to hit play here.
As there's no audio, Zahida, you can even provide color commentary if you'd like, because
oh, okay. I apologize. I thought that the sound was coming through.
Yeah, that's one of the tricks about Zoom. Sometimes it's
I
not.
see. Okay, all right. So maybe what we'll do is we'll just stop it there. Apologies for that. Technology sometimes does not always work in the way that you want it to work. But it just, I hope you got a chance to see a little bit of the screen. And this video is available online at the screening website. And so feel free to go and check them out. And so I'll just go on to the next slide here. Oops. Okay. As I said earlier, when the test kits first arrived and the strategy was first developed, administration of the test required a healthcare professional, and self-collected nasal swabs are now permitted under the observation of a trained individual. And training is required for anyone that is collecting or observing the self-collected nasal swabs. And there's a short video, but recognizing that it may not be coming through, I will just ask the audience to feel free to go and check out the videos that are available online at the Rapid Point of Care Screening website for you to review at your own leisure. Okay, so I spoke a little bit about training a short while ago, and I just want to take a few minutes just to talk a little bit about 5 key components for training that is required. And all of these, the standards for training are outlined in the program's guideline requirements and standard operating procedure document that's available online. One area that requires training is with respect to personal protective equipment, how to put it on, how to take it off safely, what's appropriate from a hand hygiene perspective, which I'm sure everyone is familiar with. The second component is with respect to sample collection, how to collect a nasal swab sample and extract a sample into the tube. Testing, how to perform the antigen test and how to correctly interpret the results. And there are videos online to support this as well. How to use the e-form application to report results to public health. And then how to do reporting of results and how to guide an individual who gets a positive result for appropriate follow-up. And in addition, the documents that we have include a competency checklist so that an individual is able to demonstrate that they understand how to perform the steps that are required for each of these procedures, and both the trainer and the trainee can sign off on competence. So how does one become a trainer? So BCCDC is hosting Train the Trainer sessions. The idea is to provide organizations to send 1 or 2 trainers per site to attend one of our training sessions, who would then in turn take that learning and share it with additional people as needed to meet the requirements of the organization. And just a note that training trainers with the BCCDC is not a requirement. If an organization has another avenue to ensure that the training and competency requirements that are laid out in the program guidelines and requirements and standard operating procedures without support from BCCDC, this is absolutely permissible. With respect to ordering the kits, as you know, the Ministry of Health through PHSA will provide access to the Abbott Panbio Rapid Antigen Nasal Test Kits free of charge for operators. We ask that interested individuals complete an intake form, and organizations are also required to sign an agreement with PHSA for access to these kits. And after receiving a signed agreement, PHSA will provide the organization with a order form on and provide additional details on how to receive the test kits. So in terms of the support that the province's screening program provides, as I have mentioned, there are online available standard operating procedures, guidelines, and requirements. There's a number of training videos, and again, I apologize for them not quite working earlier, but there's a number of videos, and I encourage all of you to take a quick look at those. It really does give a sense of what's involved. And we also are providing Train the Trainer sessions so that a couple of folks from each site could be sent to get the training, and then in turn share that information and the knowledge with others that will be performing the testing on site. So in terms of getting started and next steps, I would encourage any operators that are interested to go online and review the guidelines, requirements, and standard operating procedures, and have some conversation internally with your leadership teams. And if you feel that this is something that your organization would like to get involved with, and you feel like you're able to meet the minimum implementation standards, please contact us by email, and we would be pleased to send you an intake form to get you going. And that is the end of my presentation. Thank you again so much for the opportunity.
Thank you very much, Zahida. That was terrific. Great information there. Now, is this information you presented today going to be made available? There's something about PowerPoints that people love them. They're so simple, and I know, but there is a link that has been shared in the chat box, which is from the BC CDC website, bccdc.ca/POC screening. So is that the one that we should be relying upon?
Yes, all of the information I've shared is all available online, and the videos will work there.
Okay.
Promise.
I'm gonna get you to stop sharing your screen now.
Oh, yes.
I think they're terrific.
I got that. Thanks.
Okay. So what I'd like to do now is introduce again our additional panelists and get the range of perspectives that all of them will bring, and then we'll have a chance for everybody to kind of weigh in. There'll be some questions as well. So I'd like to start off with Dr. Victor Leung. Victor, again, was the person who you saw online leading the pilot, actually conducting the tests in care homes. I believe there were 5 sites that were originally set up in Vancouver Coastal Health. I think a couple of them were Providence sites, and there were a couple of contracted providers as well that were involved. And so Vancouver Coastal Health has been doing this now for some time, and other health authorities have been beginning to embrace it as well. So maybe Victor, I'd like to sort of start asking a little bit about what were some of the key takeaways that you had during your time involved with doing the point of care screening in the pilot.
Sure. So I work closely with Nancy Maddock and also the Vancouver Coastal Health medical health officers, as well as the long-term care, to get this going before the nasal swabs were available. This was when we were still using nasopharyngeal swabs. So the main challenge back then was ensuring staff were comfortable using nasopharyngeal swabs. I think we've come a long way, and seeing what other countries have done, it's made a lot simpler now with the nasal swabs. And in my personal opinion of having worked with medical students, healthcare providers, different levels of healthcare providers, whether it's acute care or in the community, it's so much easier now to do that I think we need to move towards the next steps, which is permitting self-testing, not necessarily even at a facility level, but self-testing at home before a provider gets to work. And we've seen that done in the UK now, where students, there was a recent Globe and Mail article from today highlighting that students as young as 5 years old can be doing this at home, using a targeted approach, especially in areas where we have hotspots. One thing that we haven't been able to do is expand this out when we had the large outbreaks that were occurring. And that was due to a lot of factors, just availability of resource, figuring out logistics that PHSA has now all prepared. But I think that the hotspots really have moved, and that's a good thing. It's a good thing because of vaccinations that have gone through. And there's still opportunity for its use in long-term care facilities, but also rethinking how this applies to other hotspots, given all the lessons we've learned on the ease, the accessibility, and also the valuable information results will give us.
Let me ask you about the just a specific time during the pilot. And I remember we had a little bit of an exchange through, we messaged each other, and I reached out to you because I was excited to see, and I realized that it was, you were kind of bound by the responsibilities of being somewhat discreet on how this, but what was it like when you actually had that first positive test come through? And I think there were at least a couple of cases during the pilot when that happened. Did that give you that that kind of validation of all the work at the time?
Yeah, personally it did, because I think there was still doubt whether the screening tests were as sensitive, because initially the message is that it's not as sensitive as PCR. But I think we looked at it in a different way. If we're talking about sensitivity, we have to compare to what is the gold standard. And the PCR is giving us a lot more information because it tells us that a person has been infected. It doesn't tell us if this person is likely to be infectious. And what the screening tests allow us to do is pick up people early before they realize that they may be infectious. And the process that Nancy developed along with public health, it worked right away, and it worked in other facilities as we saw it implemented. So I think from those lessons, now we need to see how do we make it even more accessible to places where they are identifying the biggest needs.
And I know Nancy's going to, when she speaks a little bit later, is going to speak to a little bit about the future of the rapid testing. I'm reminded of a story that I saw that just warmed my heart. It was a concert. I think it was held in Spain. And the concert was the requirement of being able to attend a concert. And I got to tell you, if there's something that I miss during this bloody pandemic, it's not being able to go to the Commodore Ballroom and see one of my favorite bands. But the requirement was to do rapid testing before they came into the arena to watch the concert. So you saw thousands of people assembling in a way that used to be a very huge outbreak in the country of Spain as well. So I think that's the kind of difference that we could be seeing, and having the ability to self-test at home before you go out and provide the results of that test would be a very interesting new development. So I'd like to now just thank you very much, Victor. I'm going to just talk to Debra Hauptman, who has been involved for the last several weeks in doing rapid testing at Langley Lodge. Debra, what was it like going in there when you went in there? Obviously, is enthusiastic. Are you still enthusiastic about rapid testing and where it's going? And you'll have to unmute.
Thank you for inviting me today to join this very accomplished panel. I feel very humbled. I, can give a bit of a practical perspective on what it looks like. All of Zahida's information that she went through is very, very thorough. And so you may have questions about, well, what did that look like, in a long-term care home? And so we applied to the Fraser Health Pilot Project. We've been very anxious to get our hands on rapid testing, and it's going very well. And we're absolutely committed to this and remain so. And we are looking forward to the next steps when we can roll it out to a broader group, for example, visitors, which we're hoping to be able to do the self-tests with visitors very soon. We've been accepted into that part of the program. We trained nurses, so a handful of nurses. I also went through the training because I wanted to, I just wanted to experience it myself to know how complicated or uncomplicated is it. And because we were doing the training through Zoom, I was able to be in the classroom. And so I can tell you that the training is very straightforward. We had a demonstration, we went through a process, we had a competency quiz and then a competency demonstration. And that was essentially all that was required. And the video that Zahida showed part of, the videos are excellent, and they take you right through from start to finish and how to set everything up. It's believe me, very, very easy to do. And I think the questions that we had were not so much about doing the test. We thought we could master that. It was the workflow. We were feeling a bit more anxious about the workflow, especially if you're testing a lot of people. With the pilot, they really gave us the opportunity to determine how broad we wanted to go in the beginning. So we chose our behavior stabilization unit, where we know that we had the most serious outbreak back in May last year. And then one other unit, so that we have a bit of a comparator. And we are testing all of these shifts, all of the workers in that home area, whether it's housekeepers, dietary, care aides, nurses, and every shift twice a week. And so far we have not detected any positives, but I have a colleague who has in their part of the pilot, and they have so far identified 2. And, you know, the point it is just so worth it. You know, if we had this when we had our outbreak last May, I'm certain that we could have had a significant impact on our outcome. And I really strongly encourage everyone to go forward. There's an ordering process in place that's very simple. You know, although Zahida talks about all the documentation and reporting and so on, we've done this with reporting positive cases. We've kind of gotten figured out how we work with public health in a pandemic. And so this has been fairly just like one more piece of the puzzle to implement, and it's going very well.
Having the experience that you did last year with the outbreak, there must be, from the standpoint of your staff, still some kind of lingering anxiety about what it means to have COVID enter the care home. How have your staff responded to the tests? Do they see them as an inconvenience, or do they feel like that they are something that is going to make their workplace safer and their life better?
It is voluntary, and so on that basis, we've actually had very strong uptake. The majority, I wouldn't say all, but the majority have stepped up. And you know, we believe, myself and my leadership team, that because of the experience we had with COVID, there is a very strong determination here in our workforce in Langley Lodge to never go through that again. And I think our staff have been very determined to do everything that they can to prevent it. And this is one more layer, as Zahida said, it's one more layer in the screening that we're already doing. It takes 15 minutes. It's, you know, and if we can, you know, prevent somebody from coming in and spending the whole day here with symptoms, or without symptoms rather, and transmitting virus when they're not aware that they even have it, we're already ahead of the game in terms of preventing another outbreak, and that's our goal.
Thanks very much, Debra. You did mention, you talked about not finding the reporting too daunting, but Victor, I think you wanted to add something about a tool that's been made available for data collection.
Yeah, recently when we had all the log sheets, although it was still accessible, that subsequent process of having to fax and transmit information, some places found resource intensive. So our digital products team developed a program that's now been approved through privacy and security that allows each healthcare worker a unique QR code. So they can scan their QR, and once they've registered once, subsequent testing, they could just put the result, whether it's positive, negative, or invalid. And then this allows the facility to access the information on a dashboard. So if you have a positive result, of course, report it through the provincial e-forms. Then you have this dashboard to transfer over to PHSA as well, instead of necessarily having lots of paper. So I think it adds another option for facilities that might want to use digital tool. All it requires is a smartphone, has a camera that you can QR code to, and then log in the information on the website once, followed by results reporting. And that is customizable. We recently were asked by one of the long-term care facilities that may have had an exposure event that wanted to try this, and within overnight you could create it for the facility, customize it to someone there who is responsible for reporting.
When you talk about this new technology and these advancement of these tools, it makes me think about the future of care, and is a good segue for my next questions for Nancy, Dr. Nancy Maddock. Nancy, when we did a pre-screen discussion a few days ago, you did talk about these tools being more commonplace. Can you maybe talk a little bit about your involvement in the pilot, the delivery of this program, and where you think it's headed?
Oh, absolutely. I think a number of us on the panel early on had worked with our public health colleagues at Vancouver Coastal Health to initiate COVID-19 rapid antigen screening at a few long-term care sites in early December, as you said. And if you remember, that was at a time when we were facing a number of very unfortunate COVID-19 outbreaks at our long-term care homes, and we had not yet had availability of vaccine. Early on, we learned that the most successful pilots were ones that had maybe a very enthusiastic and supportive nurse leader or champion on site to promote the screening among staff, sites that had available human resources, the ability and availability of people to conduct the testing, and as well the sites that had a close partnership with a local laboratory to be able to perform prompt confirmatory testing for any of those positive cases. Early on, a lot of the feedback we got from long-term care staff was good, and one recurring theme was that the frequent testing by nasopharyngeal swabs was a barrier. It's a barrier for training. Certain healthcare professionals have to be able to perform that collection of specimen type, and B, it's also uncomfortable for staff to undergo that specimen type on a frequent basis. And so I am excited now about the availability of the new kits with nasal swabs. I think this will ease training and also make the frequency of testing more acceptable for staff. And at this point in time, our pilot has expanded. We now have over 20 long-term care homes that have been trained across Vancouver Coastal Health. A few of them have begun including visitors and families in their point of care screening programs. And so I do think it's important for any screening program to be flexible and to always respond to the changing transmission and dynamics over time. And so now as we see our vaccine rollout, which first prioritized long-term care residents and long-term care staff, but we have not yet been able to cover many members of the public at large, and we're still seeing relatively high community transmission rates. I think some long-term care homes see the value of including visitors in their screening programs. And so far, any visitors who have participated have had good feedback and have been appreciative of the opportunity.
Well, that's exciting. You sort of answered all my questions, which is this something that we're going to be able to move with our social visitors to really address the need for people who are residents to be able to maintain contact with folks. Obviously, and moving away from the nasal pharyngeal makes it a more palatable, I suppose. What have been probably some of your bigger takeaways of the work that you've been able to do for the last several months? Is it just getting the program off the ground and proving it, or it has been the number of people who have been embracing this program?
Yeah, I think the key to success to programs like this is engagement and teamwork among everyone involved. There are a few sites early on who were interested in the screening, but if they just didn't have the available human resources or they didn't have the leadership engagement, the pilot was not successful. As long as you have good partnership with a laboratory or a program that can do the training for you and confirmatory testing, and then you have a great team on site who's promoting the point of care screening, I think we've seen that those are the most successful pilots to date.
That's terrific. Thanks very much, Nancy. You know, I'm going to look at some of the questions that I have here, and I'm going to try and get them out of the chat box here. I see Mary Ackenhusen has just sent a note to the panelists. Basically, she's paying, and of course, she's the former CEO of Vancouver Coastal Health. So very kind words from Mary on the work that all of you have been doing in terms of trying to get those tests out there. There have been a few questions about the new QR code tool and its rollout. I know it's really new, it sounds like, but do we have some sense of how widely this tool will be made available? Either Zahida or Victor, maybe you can answer that question.
I haven't had a chance to discuss this with Zahida yet because with our work in different health authorities, and I think initially it was developed because of our experience related to the outbreak. And so we did a pilot with healthcare workers doing at-home self-testing. And because they had to collect the information on sheets and bring it back in, that's where we discovered it was quite difficult with people doing various shifts. So the feedback was good. And one of the things we learned from this was, how can we develop a registration system that was simple and didn't require a healthcare worker to enter all the information that would pass privacy and quickly go through security at the health authorities. So what I've heard from our partners in the digital products team is that this can be shared with organizations and the health authorities. And when we had the ask to consider this at a long-term care outside of Providence, we were able to generate that overnight to allow for QR codes to be used. And so I would imagine that this is something flexible, and he would just have to program it to a facility so that the person at designated individuals at the facility could access the dashboard. And it's only 3 registration steps: QR code scanning, name, and a contact phone number. And after that, every subsequent test is just using the same QR code to log in. The result is positive, negative, or indeterminate. So please, I'll leave my email, and hopefully we can connect you with our digital products team to see how this could be shared with facilities across the province.
And the beauty of a live Zoom call is that we've just given somebody a lot of work, but that's okay, because it sounds like it's a really great tool. And thank you for flagging it for us, Victor. One question that I've got in the chat box here, it spoke about screening from Zahida's first slide, and it talked about using the POC tests for individuals without symptoms. So if somebody has if an individual does show symptoms, would a point of care test still be used? And I think I know the answer to that, but anybody want to answer that question? And I also want to make sure that Sharon has a chance to, because she's also on the call with us, and is available to answer some questions from her experience in the care setting. So maybe Sharon, do you want to take that one on?
Yes, I can take that one on. At this point in time, we're not offering this to people with symptoms. As most of you know, at the front of house screening takes place. That's the first step. So whenever people arrive at a care home, they're screened for symptoms. If they have symptoms, then they're turned away and they go to get an actual PCR test. And that's really important to remember. This is only for people who do not have active symptoms.
Okay, thanks for that. This might be a question for you, Sharon, or even for Debra. But the question is about how much time do you need? So if somebody, if I could find, I've got so many questions here. It is basically a question is, when people come in, how much time do they need to be able to do the test before they can start their shift?
They can just come in, we can take the sample, and they can go ahead up to the unit, and then we will, chase them down with their results. So it doesn't waste any time at all for them. And it's just 5 minutes before their shift starts is all we need to get the sample.
Okay, thanks for that. Actually, there's somebody asking here, and again, it's about thinking about the not only the inside the care home, but things that are connected to the care home. So I see a question asking us whether there would be any consideration of offering this test to handy dart drivers who would be responsible for transportation of some of the residents. Has anybody thought about making that available? And if not, maybe that's a good idea that somebody needs to pursue. Okay, nobody's willing. Nobody's willing.
I think that if the idea is to socialize this and make it accessible to people related to long-term care for this particular purpose, I don't see any reason it shouldn't be offered to those who are affiliated with long-term care, going in and out and transporting people.
There's a question in the chat box about the different tests that have been approved. We've been talking about the Abbott PanBio kits. Can I, just for my own clarity, with the new nasal swabs that have come in, are we still able to access that stockpile, or are we going to have to find another use for the old kits with the longer swabs? Does anybody know that?
Mike, it's Zahida, I can speak to that. So there is an adequate supply of the nasal Abbott PanBio available for use for this workplace testing in sectors where there is high risk of transmission and outbreak, which is the focus of the PHSA program.
Excellent.
Nancy, I mean, some places also have swabs that could replace the nasopharyngeal ones if and that's accessible as well, but not necessarily through the PHSA supply. It's just been established that swabs could be used and validated. But I think that for this program, it's under the PHSA supply.
That's right. Some programs are still using the nasopharyngeal swab kits, but there may be a plan to try to swap out the existing nasopharyngeal swab kits with externally sourced foam tip swabs that could be used for bilateral nary sampling.
That's terrific. So the question that has been asked a lot lately is we're now in the era of the COVID vaccines, and they clearly have changed the landscape. We're not seeing as many outbreaks. We're seeing virtually zero fatalities related to COVID in care, although I know that there are some exceptions to that. What do you say to those who say, well, I've got vaccination or enough of our staff are vaccinated? Should rapid testing still be taken as another measure when we have vaccination underway? I don't know who wants to take that one, but I would say to anybody on the panel who would like to ask to respond to that.
I'll jump in. We're going to have still a lot of movement in and out of long-term care homes. We have not invited our volunteer workers back into long-term care yet. We have new hires, we have unvaccinated workers, and we have admissions from community and from acute care. And in some cases, there's not a history, or we know that they have not had their vaccinations. So I don't see that, vaccinations even as we get more and more people vaccinated, that this is going to diminish the need for rapid testing at all. Actually, I think we will still want to use it as an added layer of screening.
Thanks, Debra. Nancy?
Oh, I do think that's an important question. And we have to remember that vaccination is one public health measure, just like rapid antigen screening might be one infection prevention control measure. And after staff are vaccinated, we don't discontinue all of our other measures. So they still practice hand hygiene, they still practice social distancing, we still use appropriate PPE when we're in certain settings. And so for now, the rapid antigen screening program fits into that category as an additional layer of protection, one additional measure.
Thanks for that. I'm looking at the Q&A box here because we've got the chat and we got the Q&A, and then somebody, this is a question, I'm going to interpret it a little bit. It says somebody could speak to the possibility of care workers and family members in private home care supported by the help from Interior Health. So I'm assuming that they're talking about a bit of a blend of making the tests available for community health workers and potentially to private home health or support and workers. Is anybody talking or thinking about how we would be able to make these tests available in these settings? And Zahida, maybe you have some comments on that?
Thanks, Mike. The PHSA's rapid point of care screening program is designed to screen employees in workplaces where there's potentially high risk of transmission or outbreak. We're operating under the guidance that's established by the Provincial Health Officer in the Ministry of Health. I understand that we have some ministry staff listening in and definitely could, take this kind of, line of thinking away to leadership for thinking, but the PHSA rapid point of care screening program intended for workplaces and employee screening in settings where there's high risk of transmission or outbreak, such as the continuing care or long-term care sector.
Thank you for that. Debra?
Well, just that I read recently that Health Canada has approved a home administration kit. So, and I know they've approved them in the United States, manufacturer from Australia. So, it may be in our foreseeable future that we'll be able to purchase kits at our local pharmacy to administer at home.
I certainly hope so. And I hope the cost too makes it affordable as well. I know that PanBio tests are sort of priced around $6 a piece, which is reasonable. But some other testing solutions are much more costly and would probably be prohibitive for most consumers. We've just got 5 minutes left, and I promised that we would have things wrapped up by 1 o'clock. I'm going to go again to the chat box here. Is there do you anticipate seeing rapid testing centers potentially in communities across British Columbia? Is this some, obviously we've had the PCR testing taking place, but would rapid testing be available for the similar types of scenarios?
I'll start off with that one. So many of you have seen that in Nova Scotia, the public health along with the lab has done community pop-up clinics. And these pop-up clinics were one of the first in Canada not to use healthcare workers to staff. It was staffed entirely by volunteers. I think there is a move for other provinces to see how they can emulate those systems, because the huge advantage of that is if it targets the areas where you have the hotspots, that is where you need the most community engagement. And working with the communities to empower them, as Dr. Lisa Barrett has said at various interviews, having them involved, empowered to know that they can have this testing done to break the chains of transmission early on, and having community involvement is one of the best ways to have empowerment. So I think that we should be strongly considering how business community advocacy groups that target particular hotspots can set up community testing with the help of the health authorities and volunteers in the community. That's where I would like to see things happen, where we have the biggest where we have the highest transmission throughout in the province.
Thanks very much, Victor. So just with a couple minutes left, I'm going to go to one more last question, and it really is just about, actually, you know what? I'm not even going to last question. I'm just going to wrap things up and thank everybody, because I just realized we're getting a little bit short on time. So I'd like to really thank everybody and all of our, first of all, for everybody who's attended today. Some really great questions in the chat box, and we'll save them, and hopefully we might be able to, if you go to bccare.ca, and we'll share it with SafeCare as well, we'll make sure that we can wrap up with some of the information that was happened here. We'll also make this recording available of today's talk, so you can actually view it on our YouTube channel, and we'll make sure that that Zahida's information and links are all available. And so thanks very much to our esteemed panelists here, Dr. Leung, Dr. Maddock, Zahida, Jean, and Debra. So great to have you all here today. I'd like to thank Jenny Cannon from SafeCare BC, who did the bulk of the legwork for today's talk. And it's because we flipped a coin that you get to see my mug today instead of hers. Thank you, Jenny, and the team at SafeCare for all your efforts during the pandemic. And thanks to Kathy Smouse and our Crack Events team for pulling this together in a great session as well. I'd like to, Kathy would shoot me if I didn't tell you that we're going to be hosting our annual virtual conference at the end of the month. Go to bccare.ca, an incredible lineup of fantastic panelists that are shaping up for an amazing 3-day program. I hope I would invite you all to go take a look at that. It's a great deal and a great way to get a lot of new knowledge about the work that we do. And we also have another Lunch and Learn happening next week. It's related to the question of whether vaccines should be mandatory. So we've got a terrific panel for that. Again, go to bccare.ca and look on the registration for that Lunch and Learn. And so as we see a continued downturn in outbreaks in our care settings here in BC, we hope that this has provided everyone in the audience with some valuable information about how rapid testing can help stop the spread of COVID-19, whether it is in care or in our daily lives. Some suggest that rapid testing will be a part of the new normal after the pandemic. At the very least, we hope it will protect all of us. I wish you all a very pleasant afternoon, and thanks very much for attending.